Hello, everyone. In today's video, we're going to be talking about referral coordinators. We're going to be going over interview and questions. But before we get started, I'm going to share my screen and we're going to discuss what is a referral coordinator, what do they do, what skills, so you kind of get an idea of what kind of interview questions that they're going to ask. So go grab your coffee and your tea and take some notes, and we're going to dive right into it. Again, I am going to share my screen and we're going to go ahead and we're going to do this presentation. So again, I'm so excited to be here and to work with you and get you to the next level. So we're going to go ahead and dive right into it, okay? We're going right here, presentations and present, okay? So it's presented by no other than the rest of Sweat, and the date that I'm recording this video is November 17th, 2025. And we're going to be talking about top referral coordinators, interview questions and answers. I'm going to give you 13 interview questions and answers so you kind of get an idea. So when you do go in for a certain job title, you kind of understand, okay? So basically, before we get started, we need to know what is a referral coordinator. A referral coordinator is a healthcare support professionals who help manage and organize patient referrals between doctors, specialists, and medical facilities. They make sure patients get the care they need by handling all communication and paperwork behind the scenes. Now, if you're like me, I always want to know what a referral coordinator does. So basically, they process referrals, receive referrals requests from doctors or nurses, verify patients' information and insurance details, send referrals to the correct specialist or facility. Work with insurance companies, check prior authorizations, confirm coverage and benefits, communicate any insurance requirement to patients or providers. Again, they communicate with patients, explain the referral process, provide appointment details, answer questions about the next step. Okay. They also track referral status, follow up with specialists to confirm the patient was seen, update the patient medical records, ensure all reports come back to the primary provider. They maintain accurate records, enter referral notes into the EHR, which stands for Electronic Health Records. They keep everything compliant with HIPAA and client procedures. Where referrals coordinators work, they work you'll see them in hospitals, clinics, specialty practice, insurance companies, telehealth providers, okay? Now, the skills needed: strong communication, medical terminology, insurance knowledge, organization, and multitask, and computer skills as well. Now, again, they schedule appointments, coordinate with specialist office, help the patient find the earliest available appointment. They make sure all necessary documents are sent before the visit. So that is what a referral coordinators do. Now we're down to like the interview questions. So I am giving you a sample. This is what I came up with. And you could take you some notes when you go into an interview. It'd be similar, but again, you want to put it in your own words. We always hear, tell me about your experience working with a referral. They want to know step by step of what you do as a referral. So that's why it's very important to be honest. If you never was a referral coordinator, just be honest and say, I've never done it before, because they're going to ask you questions that's related to the job title. This is what I would say when they ask the question, tell me about your experience working with referrals. I have experience verifying insurance, entering patients' information, and communicating with medical providers. I'm comfortable working with EMR system, tracking referral status, and ensuring all required documents are completed. I focus on accuracy and timely follow-ups to make sure the patient is scheduled and the referral provider are all updated. That is what I would tell them if they ask this question, tell me about your experience working with referrals. Now, the next question, interview question: how do you verify a patient's insurance before processing a referral? Again, they want you to walk through like a day in the life of a referral coordinator. I start by checking eligibility using the insurance portal or the EMR system. I refer coverage, co-pays, specialist requirements, and whether prior authorization is needed. If authorization is required, I gather all clinical documentations and submit the request, then follow up until approved is received. I always document each step so nothing is missed. So if I close my eyes, I can kind of visualize what is the day in the life of a referral coordinator. So that is what you want to be able to do, is visualize the hiring manager, just to visualize what you do as any job title. Okay. And then they may ask, a referral requires prior authorization. What steps do you take? I confirm the insurance policy rules, gather the necessary medical notes, diagnostic codes, and provide information. I submit the authorization request through the insurance portal and track it daily. If additional documentation is requested, I respond quickly. Once approved, I notify the patient, the referral provider, and the specialist office. Okay. How do you handle a referral that was denied? Okay. This is what I put in my own words. First, I review the denial reason to see if it was missing information, incorrect coding, or insurance limitation. I communicate with providers to determine if an appeal is needed. I gather support, clinical notes, and resubmit. I also explain the denial to the patient clearly and respectfully, offering alternatives if available. It's communication. That is the key. You got to communicate. That's real the key. How do you stay organized when managing a high volume of referrals? This is what I put in my own words. I use tracking logs, EMR dashboards, and prioritize list. I complete urgent referrals first, then work through routine ones. I'll update each referral status as soon as something changes. This prevents duplication and ensure no referral is overlooked. Strong organization helps me work efficient, even under pressure. Describe a time you communicate with a frustrating patient. Okay? I listen first and let them express their concerns. Then I explain the next steps clearly. For example, a patient was upset because their referral authorization was delayed. I check the status, contact the insurance company, and follow up with the patient within the hour. They appreciate the professional, and that's what I've done in the past. Is even though if I don't have the answer, I still pick up the phone and call. A lot of times you call people, they never respond. It's just like they don't even respond to email. You do your part. You go beyond your way, and that's what I've done. What EMR system have you used? Okay, so this is what I said, what I have used. I have used systems like Epic, eClinical Works. I can adapt quickly to new system because I understand how clinical workflows, documentation, and referral module typically function. I'm also comfortable learning new features and searching patients' records efficient. Okay, how do you ensure patient confidentiality? HIPAA question. I only access information required for the referral process. I avoid discussing patients' information in public areas and make sure electronic data is secure. I follow HIPAA guidelines at all times by verifying, identifying before sharing information, and keeping documentation in store appropriately. What will you do if a specialist office says they didn't receive the referral? This is how I will respond. I will first confirm the fax email was sent. Then I'll resend the referral with all attachment. I'll also call the specialist to verify they received it the second time. After that, I'll update the EMR and notify the patient if needed. My goal is to solve the issue quickly and keep all parties updated. Why do you want to be a referral coordinator? Okay, this is how I answer it. I enjoy administrative work and help a patient navigate the healthcare system. I'm detail organized, and comfortable working with insurance and medical terminology. I like ensuring patients get the care they need without delays. This role fits my strength and my passion for patient support. You got to go in with confidence. Okay, people can tell if you don't have any confidence. You got to have that confidence. And then we're going to go over, this is bonus, of behavioral questions and answers so you can see how that works. They'll ask you these questions to see how you can handle stress. Like, how do you handle multiple providers requesting referrals at the same time? This is how I would answer it. I prioritize based on urgency and clinical needs. I complete stat referrals immediately, then process routine ones in order. Clear communication with providers and accurate tracking helps me manage workload efficient. Okay. How do you track referral progress? Here's my answer. I use EMR referral dashboards, tracking spreadsheets and notes. I check status daily and follow up with insurance companies and specialists. This prevents delays and ensure a smooth workflow. What will you do if you didn't understand a clinical note or diagnostic code? Here's my answer. I would ask the provider or medical assistant for clarification. It's better to get accurate information up front than risk sending incorrect referral data. And these are the answers, like y'all, that I would actually show you and go over so you'll understand, what is a referral coordinator and the questions, the interview questions, the kind of, I like to have, me in my life, I always like to have I'm visual, so I like to see things so I can put it in my own words. So I'm trying to help you, because when you go in for an interview, these are the questions that they ask, and you need to go in prepared. People can tell if you prepare a plan. They can tell if it's put together really good, and they can tell if it's not, y'all. So comment below and let me know, have this help you? And don't forget to like, comment, and share these videos. I'm start getting videos out every single day because I am trying to, help as much people I can, educate as much as I can. So go share these videos with everyone you know that can benefit from it. And don't forget to turn your notification on, and don't forget to subscribe to the channel, y'all. Y'all not subscribing to the channel. I look at you not subscribing, so make sure you subscribe so you won't miss out. I want to leave some encouragement words with you, like I always do, because we're going through something. Like I said, we need some uplifting words each and every day of our life. Unfortunately, we're not under positive people. We're so under negative people. People are not going to support you. They're not going to say, hey, you got this. They're not going to tell you look good, because they don't want to make your head big. But I'm encouraging you and telling you, hey, you got this. You got to keep pushing through. And I want to leave this encouraging words with you because you're my family. And I want to read this. Hey, family, just a reminder, no matter what this week throw at you, you're still standing. You're stronger than you think, and your breakthrough might be closer than you realize. Keep going. I'm rooting for you. Okay? So just remember that. Don't forget to like, comment, subscribe to the channel. And thank you so much for watching. And I will see you in the next video. Bye.